There is a lot of confusion in the industry about home care, home health, and hospice. My name is Abby Zachariah, and today we're going to be talking about the differences. What is home care? So, home care involves hiring a caregiver or a nursing assistant or a nurse aide to help with activities of daily living or independent activities of daily living, which includes something like bathing, dressing, grooming, and light housekeeping, medical transportation, errands, sorting out mail, and also companionship. Those are home care. And for home care, it ranges from like an hour to 4 hours to somebody needing help around the clock. And also home care, the way that we pay for home care, someone pay for home care is different from home health. With home care, it could be private pay, which is personal funds. It could be long-term care insurance. It could be service through the VA, Veterans Administration. It could also be through state program like Medicaid waiver. It could be through respites, which are some local organization and support for primary caregiver. What is home health? Home health is a skilled services provided by a registered nurse, a physical therapy, or occupational therapy. So these services is tailored towards also improving somebody's physical health. Home health is a service that is paid for by Medicare or most medical insurances to provide nursing services and also physical therapy and occupational therapy. It's usually 2 to 3 times a week, depending on the needs of the patients. Home health is a short-term service with the target goal of getting someone back to their baseline. Home care and home health work together. Like home care can support home health to keep somebody out of the hospital. With home health, we have a physical therapy, occupational therapy, and a nurse coming out few hours a week, while home care can be there around the clock or more hours to ensure that what the physical therapy and the occupational therapy is teaching the patient, the home care can reinforce those instructions. For example, in our agency, we do have in-home exercise instructions, and we work closely with our physical therapists when they come to our patients to leave us in-home exercise instructions so we can reinforce those exercises when the physical therapists are not there. It's the home care that will help to ensure that patients are taking their medication and they are following those teaching that the nursing services through home health is providing to the patient. Hospice is a service that is being provided by Medicare, and this service is tailored for someone who have less than 6 months to live. However, even though that is the definition, people get recertified all the time. I've seen people that graduated out of hospice. So hospice is a service paid for by Medicare designed to help patients and their family through their end of life, to meet their end of life needs. And their hospice services, usually, like I mentioned, is paid for by Medicare. So it's an interdisciplinary service that includes a patient having a nurse's aide, and also a social worker, and also having a chaplain to help through the process. And also, because when a lot of people hear the word hospice, people think about the sadness part of it, that somebody is dying. However, hospice is not necessarily that somebody is dying today or tomorrow. Even 6 months, people live beyond that. But the hospice is a resources. I have referred a lot of patients to hospice. We work closely with a lot of hospice agencies to make sure that we are meeting the needs of our patients. Because hospice will provide in addition to all the multidisciplinary team, they will also provide some supply. some incontinence supply. If a bed is needed, a bedside table, if they need oxygen. So hospice is a robust resources that as a nurse practitioner and also as a nurse for Cherished Hands, I encourage my patient that might be fit to go into hospice services. I refer them to a hospice agency partner that we work with. In Montgomery County and Prince George County, we work with a couple of other hospice agencies to provide support to our clients, and we work with Heartland Hospice. They also have a palliative care program that helps individuals who may not be so appropriate for hospice but need that additional support of a provider to go in their home and meet their medical needs if they can't make it to the primary care office. To learn more about working with us, go to cherishedhands.net.